Thank you for the invitation and for this giving me this important talk on can exercise prevent the onset of chemotherapy-induced peripheral neuropathy. I would say the answer to this is both yes and no. Yes, because it is preventable. No, because after a certain stage of CIPN, maybe it may not be treatable, as we say, but preventable, definitely yes. So to move on, let us know what is CIPN. Chemotherapy-induced peripheral neuropathy is defined as a somatic or autonomic signs or symptoms resulting from damage to the peripheral nervous system or the autonomic nervous system that is caused by the chemotherapeutic agents as a cancer treatment. The best part about CIPN is it is a dose limiting factor. So once the treatment is over, probably the symptoms reduce, but takes time. The common problem occurring in approximately 30 to 40% of those treated with neurotoxic chemotherapy. Most of the drugs that are being treated as chemotherapy, they do have the neurotoxic element in them, about 30 to 40%. And now let us see how it is affected. You can see some of the drugs that are affected in the different parts of the nervous system, right from the dorsal root ganglia to the ion channels to the microtubules to the mitochondria, the nerve terminals, and the neuropathies. I would not like to go into details of this, but as this picture says, each part of the nerve, the peripheral nerve, may be affected by different type of chemotherapeutic agents like platinum compounds or oxaliplatin or vinca alkaloids, etc. etc. Now, some of the common drugs that are enlisted in the slide, right from the cisplatin to the suramine or the vincristine, you can see most of the common areas that are affected is the dorsal root ganglion, the microtubules, the nerve terminals, etc. The common over here is the dorsal root ganglion, and some of them even affect the nerve blood supply. So this part becomes the dangerous part when it is affected from the nerve blood supply, then probably this goes to the permanent peripheral neuropathies. Uh, Again, the same thing. Now here, the difference, the type of the neuropathies that you get are both sensory and motor in nature, and some of them is a combination. Most of them are sensory, and that is why we say it's a dose limiting factor. Once the dosage is done or once the patient stops taking them, so probably there is a return there is a return of the senses back. However, there can be a 5 to 10% sensory loss. Some of them are sensory motor in nature, which can be definitely preventable or treatable by physiotherapy exercises. Now, let us know some of the clinical features that we can anticipate in a patient undergoing chemotherapy. This is a beautiful picture that depicts what is normal and which are the areas that get sensory diminished and which are the areas that are totally lost. In the picture that says, you can see here uh, some of the areas that are in the upper limbs are diminished, and when you come to the fingers or the tips of the fingers, there is hyperesthesia and sometimes the sensations are lost. Same thing is in the lower limbs, where you have decreased ankle reflexes on a clinical examination with decreased pin temperature and vibration sensations. Other clinical features, there can be a polyneuropathy, symmetrical glove and stocking distribution, hyperesthesia, diminished or normal knee and ankle reflexes, normal or reduced strength, which is also very important from the clinical examination point of view, and diminished sensations of the temperature and vibration. Now, again, if you divide it into sensory, what are the sensory different symptoms that you get, the motor symptoms that you get, and the autonomic dysfunctions that you get? Common ones are under sensory are tingling, burning sensations, can be patient complaining of numbness in both the arms and the legs. Patient may also complain of sudden stabs or burning sensations, heaviness in the arms and legs, thermal hypersensitivity or hyposensitivity, and reduction in proprioception. Motor, they can have a difficulty in fine and motor movements, the finger movements, balance and coordination problems. Autonomic dysfunctions include heat tolerance, altered sweating, changes in the blood pressure, and bowel and bladder digestive problems. Very important part of CIPN. How do we treat? How does a physiotherapist treat a CIPN patient? Is by doing a detailed neuro examination as well as grading the CIPN. Now, why this is important is to know which grade the patient is and where a physiotherapy would work. If you see, there are various scales here. In our clinical setting, we use WHO, a grading of CIPN, where grade 1 and 2. If I'm moving the cursor, you can see the paresthesia or decreased tendon reflexes, and the grade 2, where you have mild weakness. These are the two grades where we can really help patient treat the CIPN and prevent. Prevent is absolutely from the first dose itself, but once a patient is detected with the CIPN, then these are the grades that we treat, the grade 1 and grade 2. Grade 3, 4, and 5 become a little tougher for us to handle. These are the other sensory neuropathy sensory grading systems, which are more detailed. But if you want to have a clinical quick understanding, we do a WHO. Now, the question that was asked, can we prevent CIPN with the help of exercise? Definitely, we can prevent. You see here in the picture, I put here, these are all weight-bearing, mild weight-bearing exercises, which not only improve the strength, but they are closed kinetic exercises that may improve the proprioception also. Over here, you can see these are all close kinetic exercises that may improve the proprioception. So in a clinical setup, if you want to treat a CIPN patient who is showing symptoms like tingling, numbness, etc., please go in for a close kinetic chain exercises rather than an open OKCs. Now, this is a beautiful systemic review that I got, which says, with titled Rehabilitation Exercise and Related Non-Pharmacological Interventions, where they have shown what is the level of the studies that we have in prevention, how you treat a CIPN, and what is the treatment. If you see the blue color here, it is consistent with the level 2 and 3 studies that are clinically important. That is the exercises, endurance, and the strength training. The second is the balance, sensory motor training. The rest of them are evidence that are less, like massage, electrical stimulation, cryotherapy. Over here that you can see here, these are level 4 studies, electrical stimulation and neurobiofeedback. Now, when a patient comes to you in a clinical setup, whatever is available, we try to give. The best would be when you detect a person with CIPN is try to incorporate close kinetic chain exercises, low aerobic training, and incorporate strength training by using a TheraBand or a dumbbell exercise, and also include a balance and sensory motor training, which are very important. Rest of them can be handled later, like massage or cryotherapy, etc. And this is what we are following in our clinical setup as well. Now, this is a small, it's a nice picture showing how an exercise can help CIPN. All the exercises, whether you give a low aerobic training or whether you give a balance training, etc., it improves the blood supply to the peripheral nerves. The idea to give is to improve the blood supply to the peripheral nerves, improve the oxygen delivery to the mitochondria, and the glucose delivery to the mitochondria. Where patient is showing signs of neuropathic symptoms or a change in the gait or a balance changes, or in the muscle strength. You can get this picture and this entire article from this beautiful article in which was found in Oncology Nursing Forum in 2012. Now, some of the common things that we are doing in our clinical setup is usage of this Bosu ball and these stabilization bars that you can get, which are foam based and very helpful and very. Now, why we use a soft waste is because they may have a burning sensation in their feet. So it's very important to check the pin and tingling some sensations in their feet as well as their hands, and use this. This doesn't take much of a place. Just like a single stance or a double stance, you can start training him with human assistance or a non-assistance. This is a beautiful proprioceptive exercises which is given for a patient who is a bit young, If a patient is old enough, you can support the patient and give this proprioception exercises. The second one that you can see is a heel, the foot raise and the heel raise. The rest part of the exercises is using simple boards, wooden boards, and using a balance board. So all of these exercises would improve proprioception as well as balance in the patient. This is the article. People who are interested in doing an evidence-based study can always have a read on this, on sensory motor exercises and registered training in chemotherapy-induced peripheral neuropathy. Now, this is what we have done it in our center using a Bosu ball, and this patient is little weak, and the student is trying to help her, giving a little protrusion and the anterior sway and the side sway, and in the first is the anterior posterior sway and then is the side sways. So here you can see she's giving a side sway over here to this patient. Now single stance leg standing. She's just assisting. You can see here, she's just trying to assist and trying to give verbal commands to the patient. And over here, she's trying to give a sensory re-education to the patient, especially in patients who have burning sensations in their feet. So these are small things that you can use in a clinical setup and they give very good results. Cryotherapy is a level 2 and a level 3 evidence-based. So depends on how the patient is. If suppose patient is having a burning sensation in their feet, you can always use crushed ice, keep it in a polythene bag and give it. Or you do get these days the cooling gloves and the socks as shown in the picture. You can help your patients by using these also. So this was one more study, the evidence-based, and using this as a base, we are using the same thing in our clinical setup, using cryotherapy for selected patients. Whole body vibration is also a new therapy. It is just like it's a small machine which can be kept in your OPDs, and you make the patient stand here. You can see here the patient has raised the legs, patient has bent and single leg, standing in the with the support. So here you just need to set the frequency, rate, and the timing. Everything is given over here. You set it over here and then ask the patient to use it wherever the patient is having decreased sensations or altered changes in the sensation. The small machine, we do have it in our clinical setup. People who don't have and are seeing patients on a regular basis of CIPN can use this. This gives excellent results. Now, how this is useful, you can see here. It has an effect on the sensory system as well as the mechanical stimulation, where the transmission of the vibration is sinusoidal in nature, which is determined on the type of the oscillations that you set, the amplitude that you set, and the frequency that you set. This would in turn help in the muscle contraction and its adaptation in an acute setup as well as in the longer term. This has been very nicely studied in spasticity. It has shown to decrease spasticity, improve the gross motor function in a longer way, in a longer duration. If you are using it for 1 or 2 months, it has shown to improve strength, gait, and mobility. This also has been used. We are using this in our setup, but for very selective patients. In an acute state, there will be an improvement in the spinal excitability, stretch reflex is decreased, hypertonus is decreased, etc. The gross motor functions have been shown to improve. Again, sensory motor training and whole body vibration training have got a lot of potential in reducing the motor and sensory symptoms of chemotherapy-induced peripheral neuropathy. I would expect people to use this machine in their clinical setup. It has shown very good results, not only in CIPN, even in stroke patients and in spasticity as well. So this is all that I wanted to share my ideas and my experiences for the forum. Thank you very much for the invitation, and anybody who has any queries can always come back to me, and any queries I would like to clarify. Thank you very much once again for the invitation. See you later.